Hi, I'm Elizabeth Qualley. I direct the Supportive Care and Survivorship Clinic at the University of Alabama at Birmingham. Depression is an important health issue that's more common in cancer patients and cancer survivors than people who don't have those conditions. Come with me while I visit with a patient and learn about his experience with depression. Hi, Mr. Taylor.
Hi, Doc.
How are you?
Well, I'm fine. I know you know that I'm being treated for colon cancer.
Yeah.
But my wife wanted me to come in and talk to you about something else. I'm having some problems that don't seem related to my cancer.
Tell me about those.
Well, to start with, I don't sleep very well. I'm more irritable than normal.
Yeah.
And the nurse asked me to fill out this form, this distress thermometer. What's this all about?
Well, we have all of our patients fill out the distress thermometer because of exactly the issue that you're here with. Sometimes things happen when you're in cancer treatment and you might think they're not related, but they could be. And using an instrument like the distress thermometer helps us know how to help you best. Mm-hmm. Let's take a moment to look at this. I see you're having a lot of sadness and worry in addition to the problems that you came here with. Yeah. Can you tell me a little more about your sleep disturbance, Bob?
Well, I'm just having trouble getting to sleep at night, and I don't sleep very long once I get to sleep.
You wake up early once you go to sleep. Mm-hmm. Okay. And then do you have trouble going back to sleep?
Yes, I do.
Yeah. Has this ever been a problem for you in the past?
Not really, just since I've had the diagnosis of my colon cancer.
Yeah, yeah. Well, that can be a hard time for people. Are you feeling sad much of the time?
I have some of that, yeah.
Do you feel hopeless?
I don't know about hopeless. I don't know if I reached that quite yet, but I certainly have some concerns.
Yeah, yeah. A cancer diagnosis and going through cancer treatment can be a huge challenge for people. Hearing what's going on with you, I'm a little concerned that you might be experiencing some depression.
Well, I'm not sure if I've got that or not. I don't have any history of mental illness in my family. What is depression?
Well, depression is a medical illness that occurs when the brain chemistry changes in a way that changes your body's function. It changes how you respond to things emotionally. Mm-hmm. Moods are kind of like the weather, but your underlying mental health is sort of like the climate. And when you become depressed, which can happen as you're facing the physiologic changes that occur with cancer, in addition to the social stresses that occur with a cancer diagnosis, the financial stresses, the stress that places on a relationship, all of those things kind of create a perfect storm that can lead to depression, even in somebody who's never had that problem before.
Well, how important is it that I be treated for depression, if that is what I have?
Well, depression is treatable, and it's really important to treat it. It is one of the illnesses that we know can impact quality of life tremendously. It also can have significant health effects. We know that people who are depressed have a harder time getting through cancer treatment. We also know that people who are depressed don't function as well at home or as well on the job. And depression is often treatable. And it will help you feel better to be treated.
Well, that's pretty eye-opening. Since you've said all that, I noticed that I am more tired than normal and I'm more nervous than normal. I keep wondering what's going to happen if my treatments don't take effect. What should I do about all this?
Well, I would recommend that we think about treatment. There are a couple different approaches that we can use in treating depression. Those include medications that can be helpful. Talk therapy can also be helpful. Possibly most helpful is a combination of medication and talk therapy that helps address those things. You can also undertake some self-care behaviors to help bolster the effect of treatment. Things like exercise, meditation, those sorts of strategies can also be very helpful.
Well, you know, now that you mentioned that, I'm wondering if my wife might be having a little depression. Would that be normal?
Well, oftentimes, although we don't think about it as much, being the caregiver for somebody who has a cancer diagnosis is almost as stressful as having that diagnosis yourself.
Yeah.
So although she doesn't have the physiologic changes that are occurring in your body, she certainly is coping with a lot. And depression could be a factor for her as well.
Well, where could we go to get some help and to find out more information? I'd really like my wife and myself included to learn more.
Your primary care physician knows how to identify and treat depression, and that's a great place to start. There are also websites where you can go to learn more about depression and what its symptoms are, and think about how you might use self-care strategies to help address these issues.
Thank you very much, Doc. This has been very helpful.
Yeah, thanks for coming in. Depression is a common health issue in cancer patients and cancer survivors. It can have serious health effects if it's not treated. Depression is treatable with medication, talk therapy, and self-care. If you think you are depressed, talk to your primary care doctor or your oncologist. To learn more about the symptoms and ways to treat depression, you can go to the American Cancer Society at cancer.org.